Are you feeling just like lousy, depressed, eating carbohydrates up the wazoo? I mean, irritated? Well, you may have a disorder. Really, it's called seasonal affective disorder. It's a real disorder. And really, it has to do with the changes in the light, in circadian rhythm, and we're very sensitive to that. So during transition seasons, like in the fall, especially late fall when it gets darker, and the winter, people really get depressed. And now, with the pandemic going on, with all this uncertainty, loneliness, isolation, it's even worse. So what are some of the symptoms? Well, there's a lot of symptoms here of depression, but really some of the things that we see there, a lot of daytime sleepiness. You feel like real tired, during the day, and you're not interested in things. You got to push yourself to do things. You're feeling less energy. And look, this could really get on to something serious like suicide. Now, why is this going on? Well, what happens is there's a real change in our neurotransmitters. Believe it or not, the serotonin levels go down with a decrease in light, and we have an increase in melatonin, which makes us sleepy. So there's real neurological and chemical changes that are going on. People are moved to the southern latitudes during the winter to get more light. And there's been a real migration in this country for people to move towards southern latitudes. People come in the winter from places like Canada, down to Florida to get into the light. So what can we do? Okay, I got some real good tips, okay? First, vitamin D therapy couldn't be more important. Sunlight, vitamin D, D3, salmon, fish oils, things like that. Physical activity, really important. And now this is huge. Lighten up. Open up your curtains, open up the house, go outside more during the day, get light, be social. There's the highest suicide rates are in the northern latitudes. People, especially with pre-existing illnesses, are very prone to this. And even in Florida, people have, in cloudy days, or even in the winter, people have this seasonal depression. So it doesn't necessarily, have to be like it could happen in a place that's sunny that isn't so sunny, during certain times of the year. So if you need help, go see your psychiatrist. Take care.
Don't suffer alone. At BregmanMD, we can help with our years of online therapy experience. Just give us a call or contact us online.